Diabetes is a growing problem in our country, especially when it comes to children. November happens to be Diabetes Awareness Month, so we're thrilled this morning to welcome back to the show Dr. Alycia Daniels, who is with CHI Memorial Pediatric Diagnostic Associates. Good to see you.
Good to see you.
It's a complicated topic because we hear the word diabetes, I think, more frequently than we did when I was a kid growing up.
Right.
But people still get confused, I guess, over the two types, type 1 versus type 2.
So type 1 diabetes is an autoimmune problem. That means your body attacks itself mistakenly, and in this case it attacks the pancreas. That's the organ that makes insulin, and that controls your blood sugar and helps your body break down carbohydrates, and plays a big role in your metabolism and all of that.
Okay.
And then type 2 can present similarly to some degree, but it is more of a problem of insulin resistance outside of the body and can be more associated with obesity, and so that's one of the things that we're trying to bring awareness to.
Okay, we hear, and every mom out there listening will say, yep, I've had this conversation at birthday parties, the carpool line, you name it, that it's harder and harder to keep sugar away. It's hidden even if you're a parent who tries to not bring a lot of sweets into the house.
Right.
It's an additive in foods, right? Is that leading to the growing number of type 2 diabetics?
I think overall there's an obesity epidemic in the country, and 1 in 5 children is overweight at this point. So we're trying to bring awareness and healthy choices that you can make with your family. And I think in general, trying to stick to more natural foods, the perimeter of the grocery store, and then reading the nutrition facts on the back, like even 100% juice has a lot of sugar in it. So yeah, to some degree, hidden sugars can play a role in your overall caloric intake, and the balance of sugars and fats and proteins that your child is taking in.
Okay, so are the warning signs that diabetes is a concern? Is it different if you have type 1 diabetes versus type 2, or are they similar symptoms?
It can be similar. So in general, increased thirst, increased hunger. In type 1, you may have actually weight loss, but both, if the sugar gets very high, they can have fatigue, confusion, vomiting, and can appear ill. If the sugar is very high, they actually have like a sweet smell to their breath.
Wow.
And so those are some signs. If your child ever has those, I mean, you want to bring them right to the doctor.
Are there ages at which you really begin to see it in children?
It can be as early as infancy, honestly.
Really?
In type 1, that's more rare. You see it more commonly. Type 1, there's an incidence in school-age children, and then again, there's a bump in the teenage years. Type 2 can really be now at any point in life. We see it, as early as the early, elementary school age.
It's funny because we used to call it, even just 10 years ago, that was referred to as adult onset.
Right.
And now we're seeing it in kids.
Right.
So in treating, I guess, both, the family is a key component in the success.
Correct. So type 1, you're always going to need insulin in order to manage that, and so having the parents get on board to help with that is very important, and it's a big lifestyle change. Type 2, depending on the severity, can first be managed with diet and exercise, and so that's, of course we want to prevent it by addressing that in advance, but if they are diagnosed with that, then we try to work with the family to get everyone on board to make those healthy changes.
Approach is everything. So if it's a situation, especially of type 2,
right,
and there's no insulin pump needed or anything like that, then no 8-year-old wants to hear you can't ever have sweets again.
Right.
So at your office, do you try to have kind of a supportive approach but still be firm in what the child needs?
Oh, definitely. I mean, we want them to still be a kid, so everything is going to be, within reason. I think the majority of the time, if you're focusing on fruits and vegetables and healthy proteins, and making sure they get at least an hour of exercise every day, but making those changes for the whole family. Of course, if it's their birthday, you want them to have cake, or Halloween, they're allowed to have a piece of candy or two. But overall, focusing on moderation and making healthier choices. We can also get them hooked up with a nutritionist if a family has specific needs. And we try to address that.
So here's where you can find her. Her name is Dr. Alycia Daniels. Again, she's with CHI Memorial Pediatric Diagnostic Associates. She's typically at the Ringgold location and
Correct.
Gun Barrel, but they also have offices downtown. You can find them 698-BABY, that's 2229, or online at the website you see there. Thank you so much.
You're welcome.